Have you ever stopped to wonder what's really going on inside your brain when you take a medication for something like anxiety or depression? Well, today we're going on a special guided tour of the brain's own internal pharmacy. We're going to explore the powerful medications that work on our central nervous system, figure out how they actually work, and most importantly, talk about how to use them safely.
So, the big question is, how can a simple pill literally change our brain's chemistry? Well, think of your brain as this incredibly complex communication network, buzzing with messages all the time. These medications act like master sound engineers. They adjust the volume on specific chemical messengers, which we call neurotransmitters. They can turn the volume up, turn it down, or just fine-tune the signal to get things back in balance. So let's start our tour and visit the 4 main departments in this pharmacy.
Okay, our first stop is the antidepressant department. Now, in conditions like depression, the thinking is that there's a kind of communication breakdown happening between brain cells. These medications, which are some of the most prescribed drugs in the world, help millions of people by fine-tuning the brain's mood-regulating chemicals to get those important conversations back on track.
So what are we looking at here? Basically 4 different ways to tackle the same problem. SSRIs, you've probably heard of them, they give a specific boost to serotonin, that feel-good chemical. SNRIs are a little broader. They increase both serotonin and norepinephrine, which helps with energy and focus. Then you have the older guys, the TCAs and MAOIs. They're, well, less targeted. It's kind of like using a giant floodlight instead of a precise spotlight. And because of that, they often come with more side effects. But you know what? For some people, they are the absolute best tool in the box. You know, one of the absolute toughest things about starting an antidepressant is that it's not a quick fix. Not at all. It can take a solid 2 to 4 weeks for your brain to really adjust and for you to feel the full benefits. And that waiting period, it can be incredibly difficult, but it is so crucial to be patient and stick with the plan.
All right, let's talk about some essential safety rules. First, never, ever stop these medications cold turkey. It can cause some really unpleasant withdrawal symptoms. Mixing them with alcohol is also a big no-no because both of them slow down your brain activity. It's also vital, especially when you first start, to report any worsening of your mood. And for that older class, the MAOIs, you even have to watch what you eat. Certain foods like aged cheese or cured meats can cause a dangerous spike in your blood pressure.
And that leads us to a rare but very serious risk called serotonin syndrome. This is what happens when serotonin levels get dangerously high, and it's often from mixing different medications. This is exactly why it is absolutely critical to tell your doctor about everything you're taking. And I mean everything, even over-the-counter stuff and supplements.
Next up on our tour is the Antipsychotics department. These are really powerful medications that help people who are experiencing psychosis, which is a condition where the brain is really struggling to tell the difference between what's real and what's not. These drugs work by targeting a different chemical messenger, dopamine, which plays a huge role in how we perceive the world around us.
Now, there are 2 main types of antipsychotics. The older ones, we call them typical, are kind of like a sledgehammer. They powerfully block dopamine. The newer ones, the atypicals, are more like a scalpel. They have a more targeted approach that affects both dopamine and serotonin. And as you can imagine, this big difference in how they work means they have very different side effects.
And this brings us to a really important trade-off. See, the older drugs are much more likely to cause movement-related side effects, things like stiffness and tremors. The newer ones, on the other hand, can lead to significant weight gain and increase the risk of things like diabetes. So a doctor really has to weigh these risks and figure out which medication is the best possible fit for each individual person.
When it comes to safety with these meds, monitoring is everything. If you notice any new muscle stiffness or tremors, you've got to tell your doctor right away. These drugs can also make you pretty dizzy, so always get up slowly. And if you're on one of the newer antipsychotics, you have to keep a close eye on your weight and get your blood sugar checked regularly to catch any metabolic problems early on.
Let's just zoom in on EPS for a second. That's extrapyramidal symptoms. This is a group of really distressing movement problems. It can be anything from painful muscle cramps to a feeling of inner restlessness that's so intense you just can't sit still. And in some cases, it can even look a lot like Parkinson's disease, with tremors and stiffness.
All right, let's move on to our third department, anticonvulsants. You can think of seizures as electrical storms raging inside the brain. So these medications are designed to prevent those storms by basically calming down all that chaotic electrical activity. They're like stabilizers for the brain's electrical grid, preventing dangerous power surges.
So what does that really mean? Well, these drugs essentially put a damper on the brain's electrical signals. They make it a whole lot harder for the chaotic firing of a seizure to even get started. They're basically raising the bar for a seizure to even happen in the first place.
With a lot of these drugs, there's a sort of Goldilocks zone. Too little and it won't work. Too much and it can actually be toxic. We call this sweet spot the therapeutic window. And that's exactly why people on these medications often need regular blood tests to make sure that dose is just right.
Okay, this is so important. Consistency is absolutely critical with these medications. Missing even a single dose can be enough to trigger a seizure. For that same reason, they should never, ever be stopped suddenly. And because of the potential risks to a developing baby, it is essential to have a serious talk with your doctor if you're planning a pregnancy.
Now, there is a rare but very serious side effect we need to mention. It's called Stevens-Johnson syndrome, or SJS. It often starts out just like the flu, but then it's followed by a really painful rash. If you develop any kind of rash while taking these medications, you need to get medical help immediately. Our final stop today is the Anti-Parkinson's department. Parkinson's disease, which causes things like tremors, stiffness, and trouble with movement, it happens when the brain just doesn't have enough dopamine. So the whole goal of these medications is to restore that delicate chemical balance, either by giving the brain more dopamine or just helping it use what it already has more efficiently.
So here are the main ways we can boost dopamine. The most common drug, levodopa, is like a raw ingredient that the brain itself turns into dopamine. It's almost always given with another drug, carbidopa, which acts like a bodyguard, making sure the levodopa gets all the way to the brain before it gets broken down. Other meds work by either protecting the dopamine that's already there or by kind of tricking the brain into thinking there's more dopamine than there really is.
For people taking levodopa, timing is everything. I mean, everything. It is so crucial to take the medication on a strict schedule to avoid what are called off periods. This is when the medication starts to wear off and the symptoms of Parkinson's, like the tremors and stiffness, can suddenly come roaring back, making even simple daily tasks nearly impossible.
There are a few unique safety tips for these medications. Your diet can actually play a big role. High-protein foods can interfere with levodopa, so it's best to time your meals carefully. And just like with many of these CNS drugs, dizziness can be an issue, so take your time when you're standing up. It's also really important to be on the lookout for cognitive side effects like confusion or even hallucinations, especially in older adults.
So, we've toured the 4 major departments of the brain's pharmacy. But what are the universal rules that apply to pretty much all of them? Let's wrap things up with a simple safety checklist that you can take with you.
Here are 5 key rules for staying safe. Number 1, monitor the effects. Keep a simple journal of what's getting better and any new symptoms you notice. 2, stick to the schedule. Don't skip doses or stop taking the medication without talking to your doctor. 3, check for interactions. Remember, even some foods or supplements can totally change how these drugs work. 4, be safe. If your medication makes you dizzy, take extra precautions to avoid falls. And finally, number 5, and this is the most important one, report any side effects right away. The sooner your doctor knows, the sooner they can help.
You know, this all really comes down to one simple, powerful idea. An informed patient is a safe patient. You are the most important member of your healthcare team. Your knowledge and your willingness to speak up are the most powerful safety tools that exist. So we'll leave you with this question to think about. How can we all work together, patients, doctors, families, to make sure these powerful tools are used not just to their full effect, but with the respect and the caution they truly deserve? It's a challenge for all of us, and it really starts with being informed. Thanks for joining us on the tour today.